Gardening was out. I used to be a very keen gardener, but digging, out of the question. Shoveling snow, couldn't do that anymore.
He couldn't cut the grass.
Right. And as for the boating, well, I couldn't unload or unload the boats. It was just way too much for me.
It's estimated that as much as 80% of Americans will suffer from lower back pain at some point in their lives. For most people, pain will get better with conservative treatments. However, if you have persistent, severe, or chronic pain that radiates down your legs, or the presence of significant weakness, numbness, or tingling in your legs, your doctor may recommend surgery. You may have difficulty walking, standing, or even sitting for long periods. Back pain could be interfering with your job and the activities you love. In some cases, bladder and bowel problems may occur. Back pain has many causes, including, among others, degenerative disc disease, spinal deformity, trauma, and tumors. Degenerative disc disease refers to a wide range of changes occurring in the spine resulting from aging and wear and tear. These changes in the discs can lead to other problems, such as herniated or slip discs and spinal stenosis. These terms will be discussed in detail in a few moments.
Almost permanent discomfort, going nowhere with the various treatments, the injections, physical therapy, nothing worked. And then it was decided, well, your choice, pal, but we think you should have the surgery.
This video will help you understand more about your lumbar spine, degenerative disc disease, and open lumbar fusion surgery. This video is for educational purposes only and is not intended to be used to diagnose or recommend treatment for your back condition. Only your surgeon can recommend lumbar fusion as a treatment option. Any questions or concerns you have should be discussed with your surgeon. Let's take a closer look at how your spine works. Low back pain comes from the lumbar region of the spine. These are the 5 vertebrae that curve down from about the level of your waist. Each vertebra has a space called the spinal canal, which protects the spinal cord and the nerve roots. The nerve roots exit the spinal canal through the openings between the vertebrae on the side of the spine. In a healthy spine, the vertebrae are separated by discs that act as cushions and allow the spine to move smoothly. Over time, with wear and tear, the discs may lose their cushioning effect and the ability to move freely. This is called degenerative disc disease. As the disc collapses, the spine may lose its normal alignment. Bone spurs may form, which can grow into the spinal canal or openings and pinch the cord or nerve roots. This is called spinal stenosis. A collapsed disc may also bulge or herniate through its outer layer. This may press on the nerve roots as they exit the spinal canal and cause pain, numbness, or tingling in the leg. This is commonly referred to as sciatica. Discs do not have the ability to repair themselves like some other tissues in the body. That's why degenerative disc disease often continues to progress as time goes by. If you're already considering surgery, you've probably already been through a host of non-surgical treatments, including pain medications, exercise programs, and physical therapy or chiropractic care. You might even have had an epidural injection to reduce inflammation and pain. If these have failed to relieve your symptoms, your surgeon may recommend lumbar fusion surgery. The goals of open lumbar fusion surgery are to reduce pain, relieve swelling, irritation and pinching of nerves, and restore function by stabilizing the spine and helping you regain the ability to return to your daily life activities. During the procedure, your surgeon will remove any bone spurs that are pinching the nerves and then remove the disc. Removing the disc is called a discectomy. A spacer and/or bone graft is then added in place of the removed disc, so the vertebrae will fuse and form a solid union. The bone graft is sometimes taken from your own bone. or your surgeon may choose to use bone from a bone bank. Synthetic bone graft or other man-made materials may also be used. This can occur in any combination. Your surgeon may also remove all or part of the lamina portion of the vertebra. Rods are secured to the spine with screws to hold the vertebrae in place until the bone grafts have a chance to fuse together. This animation shows an anterior lumbar interbody fusion, though your surgeon may choose a transforaminal lumbar interbody fusion or a posterior lumbar interbody fusion. In some instances of lumbar fusion, an anterior standalone implant may be used. The bone graft should set within the first 12 weeks after surgery, and in 6 months to a year, the fusion of the vertebrae should be complete. Although in some cases, fusion may take up to 18 months. Open lumbar fusion surgery is a very common procedure. In fact, more than 200,000 open lumbar fusion surgeries are performed in the United States each year. While unusual, complications can occur during and after surgery. Possible complications include, but are not limited to, infection, bleeding, continued pain, and failure of fusion. Although surgery may be successful, some patients may still experience stiffness and pain.
3 nights, 4 days this time, and I was back home, walking about every day on a cane, and I started therapy about 2 weeks after surgery, and then just progressed from leaps and bounds. It was great.
Before the surgery, your surgeon may ask you to do a number of things to help make the procedure go smoothly and to help your body heal. If you smoke cigarettes, you'll be expected to stop for a period before and after your surgery, because smoking can interfere with a successful bone graft fusion. You'll be encouraged to eat healthy, well-balanced meals. And of course, you'll want to follow all of your doctor's instructions. You'll also want to make preparations around your home. Make sure the things you use around the house are placed where you can reach them without having to bend. This includes clothes, shoes, toiletries, kitchen utensils, and groceries. It's also important to remove any throw rugs, loose cords, and other objects that could cause you to trip and fall. After the surgery, you can expect to be in the hospital for several days. You will be encouraged to walk with assistance the first day after surgery, and you will begin a rehabilitation program designed to help you get in and out of bed and care for your personal hygiene. You may be asked to wear a brace post-op for a period of time by your surgeon. You will be shown how to apply and remove the brace. Because the bone graft takes a period of time to set, you will need to restrict activities that involve lifting, twisting, or bending the lower back for a period of time after the surgery. You will not be able to drive until your pain has subsided to a moderate level, typically 10 to 14 days after the surgery. Once the fusion is set, you will need to continue the rehabilitation and exercise programs designed for you. Your surgeon will tell you when it is safe to resume more strenuous activities. Patients are typically able to return to many of the activities they enjoy.
I'm very keen on kayaking, canoe sailing, and camping. And I hadn't done anything in 18 months prior to the surgery. I was able to go out in the kayak 5 weeks ago now, and it just felt great. It really did, because it's an important part of my life. No hesitation, go for the surgery.
The decision to have surgery is sometimes difficult. This video is not intended to replace the experience and counsel of a physician. Rather, it is meant to educate and empower you as a patient. Your surgeon will be happy to answer any questions you might have. You may also call your surgeon's office and arrange to speak with someone who has had lumbar surgery and can share that experience with you. It's just another way you can learn about the procedure and what to expect.
See my 70th in a kayak. That's my goal.
No, he's really, so much better.
Good decision. Very good.